Today I'm going to talk to you about pre-surgical instructions. If you have surgery scheduled in my office, there are specific instructions that we have for you. I'm going to break those instructions down into your activities 1 week before surgery, 4 days before surgery, 1 day before surgery, and the morning of surgery. 1 week prior to surgery, please avoid taking any aspirin products or ibuprofen. Those medications can cause compromise in your ability to clot, so we would have you discontinue those medications. The exception to that is if those medications are prescribed by a physician for some specific reason, I would want you to continue those medications. If you're a smoker, I'd ask you to discontinue your smoking as many days as possible prior to surgery. Smoking will slow down your healing and may increase the risk that you would experience post-operative complications after your surgery. 4 days prior to surgery, if you happen to take a blood thinning medication such as Coumadin or warfarin, you're most likely going to need to have to discontinue that medication for 3 days. This is really driven by your INR, which is a blood test that gives us a reading of how thin your blood is. From that number, we know how effective your clotting is going to be on the day of surgery. If you happen to take this medication, I can't make the recommendation for you to discontinue the blood thinner. We need to speak to your physician. In other words, we need to have your physician's approval for you to discontinue that medication. Generally, the rule is you'll have to be off that for 3 full days prior to surgery. 1 day before surgery, stay well hydrated, drinking plenty of fluids. When you come into the office on the morning of your surgery, we will provide you a list of your medications as well as instructions on how to take those medications. If you take other medications, in other words, medications that are prescribed by your physician, we want you to take all those medications on the morning of your surgery. An example is if you take medication for high blood pressure, it's important that you take your medication on the morning of surgery. Patients that require antibiotics for either heart valves or prosthetic joints, it's important for you to take your antibiotics as prescribed on the morning of your surgery. If you're asthmatic, it's important that you bring your inhaler with you to your surgery appointment. Wear comfortable clothing to the appointment on the day of your surgery. Patients that are not scheduled for anesthesia, such as intravenous sedation, can eat a small breakfast or a small lunch a few hours before their procedure. Patients that are scheduled for intravenous sedation should not eat anything for 6 hours prior to their surgery. That's really important to avoid any complications as a result of the anesthesia. You can have clear liquids or fluids up to 2 hours prior to your surgery appointment.